Brow lift or blepharoplasty? Which one do you choose? Hi, Dr. Dominic here, the Elite Facial Plastic Surgery. It's a great question, something I often encounter with patients who are coming in to make their eyes appear more refreshed. It's really dependent upon what your anatomy is showing. And what I mean by that, where the brow position is. As a rule of thumb, for men, you normally want the brow to be right at what's called the orbital rim, which is the bony, hard structure around the eye. Whereas with females, you're normally having the brow be above the orbital rim. Depending upon where your brow is will determine your candidacy for doing a brow lift. Now, the reason why you want to do the brow lift is if you look in the mirror and you elevate your brow based upon those parameters I was discussing with you, you're gonna see that eyelid skin redrapes and it actually opens the eyes a bit more. Now, the other part to this is the kind of eye socket you have. And what I mean by that is some people's eyes sit farther back, and when you elevate that brow, you're going to find that eyelid skin tends to redrape over the orbital rim nicely. You may not need an upper lid blepharoplasty. Whereas patients whose globes is a little bit more forward, you're normally also going to have to address some excess upper lid skin at the same time to really finish things off and make it look as refreshed and youthful as possible. You don't have to do everything at once. You can certainly opt to do one or the other, but as a rule of thumb, you're normally going to address the brow first before you address the upper lids. So what is a brow lift? A brow lift refers to this area of the body, and it normally is going to involve the eyebrows all the way up into the hairline. There are different, essentially brow lift techniques that can be utilized. There are some techniques that involve making incision way back behind the hairline called a coronal approach. You make incisions into the hairline or just behind it. There can be incisions in front of the hairline. There are incisions that can be directly in the brow for that matter. At the end of the day, it's something you need to discuss with your surgeon, but more importantly, you want that incision to be as inconspicuous as possible. You're also looking to achieve a result where you elevate the brow and help to reposition it so that way it looks more youthful, and it also will help to improve the appearance of the upper lids at the same time. So what is a blepharoplasty? What you're normally doing with an upper lid blepharoplasty is you're making an incision into the natural crease that's between the upper lid skin and the eyelid itself, and you're basically going to be removing some skin and muscle and occasionally some fat to make things look more open, refreshed, and youthful. Now, I'm sure many of you are wondering is, can you combine a blepharoplasty with a brow lift? And the answer to that is yes. And normally you're going to be addressing the brow at the same time before you address the upper lids. Because once you reposition that brow, it's going to change how much skin that needs to be removed from the upper lids. How do you know which procedure to choose when you're trying to make things look more refreshed and youthful? If you have age-related changes to the brow area, what I mean by that, if the brows are sitting below the orbital rim, then you should think about bringing that up a bit to help open the eyes a bit more. In addition, if you have a forehead height that's very high, that's where a brow lift would also help to reduce that and not make that forehead appear as large. And at the same time, you're basically elevating the brow. Now with the eyes, if you have excess skin or some fat herniating here, and you feel like your eyes, quote, feel heavy, that's where you could think about doing an upper lid blepharoplasty. And if the brows are contributing to that, you could do that at the same time. And then for the lower lids, it's more patients feel like their eyes look heavy and tired because the fat is coming forward. And that's where you need to address the lower lid fat with doing a lower lid blepharoplasty. Recovery time obviously comes into play. With all the procedures, you're looking at about, normally about a week. During that time period with the brow, with the upper lids, you're gonna have to wait to have your sutures removed after about 7 days. Usually at that point in time, with the upper lids, the incision line is fairly camouflaged by the crease you have. Bruising is also very dependent and varies per patient. For the brow, when you remove the sutures, again, where the incision is placed, you can normally camouflage that by bringing the hair forward a bit. For the lower lids, there's normally no incision for the transconjunctival approach, which I've talked about, but you will have a fair amount of pinking in the lower lid skin as it's recovering. And then what ends up happening is, as that lower lid skin continues to heal, that pinking color begins to fade away. But normally after about 7 to 9 days, you can start applying a little bit of makeup to help camouflage it. With the upper lid blepharoplasty, lower lid blepharoplasty, patients sometimes will wear glasses, and that kind of helps as well. Please take a look at our YouTube channel with other videos pertaining to the brow, upper lid blepharoplasty, and lower lid blepharoplasty.